Yeah.
Welcome everyone. Namaskara Elrigo. Just to give a quick introduction of myself, I'm Murali Bial. I'm the SoCal Karnataka Cultural Association president for the 2025 to 2027. I would like to take this opportunity to emphasize a few things that this board doesn't want just to be planning the events. We want to promote culture and create platform for our youths to grow as a future leaders. Having said that, how we are going to do? Our KCA Youth Committee, currently led by Arya Girish, who is currently in the junior year, Del Toro High School, Lake Forest, California, and mentored by our SoCal Board of Directors, Secretary Sushma. They both are together going to show what the leadership platform looks like from SoCal KCA BOD perspective. I'm also thrilled to announce that as a KCA Youth Committee, Arya and his team, they're not just stepping up, taking charge, and making things happen today, and they are here to take us through their first feature presentation, which is one of its kind. On that note, would like to welcome Arya Girish, KCA Youth Committee President, to take this through to the next step. Welcome, Arya.
Thank you, Marley Uncle, for that introduction. Let's get started right away. I would like to welcome you all for our very first session, Meet with Professionals. Our goal with this initiative is to give students like us a chance to learn about different career paths directly from the people working in the field. We will be hosting these monthly sessions to explore various majors and professions, helping students make informed choices about their future studies and careers. Tonight's session will be focused on the cross-section between biology and engineering, topics such as bioengineering, bioinformatics, and more. We are excited to have with us three amazing professionals who will be sharing their experiences. Dinesh Haryadi, who is a vice president at Massimo and studied biomedical engineering for his master's and PhD. For his bachelor's degree, he studied instrumentation engineering. The second speaker will be Umesh Satyanarayana, who is a vice president of business development at L&T Technology Services and studied biomedical instrumentation for his undergraduate degree. Our final speaker will be Abhi Sudarshana, who works at R&D Health and studied biology for his bachelor's degree. Thank you all for being here and sharing your journey with us. Hello, Dinesh Uncle. I would like to have you as our first speaker. I'm very glad to have you here with us today. Could you please start us off with a brief introduction about yourself?
Yeah, and thank you to the Youth Committee for hosting this session and inviting me and my co-panelists here. We are thrilled to be here. I mean, as always, we are here to help you guys choose a profession and make a good decision early on in life in terms of what you want to do. So with that kind of welcome, I'll take a brief minute to introduce myself. I'm the Vice President of Capnography and Gas Monitoring at Massimo. And as you clearly said, my journey has been through instrumentation engineering, biomedical engineering masters, and a PhD. And I've been in the bioengineering, biomedical engineering specifically for the last 25 years.
Thank you. So the first question I wanted to ask you was, what does the term bioengineering actually refer to?
It's a kind of a vast description or a term that's used to describe a number of things. But if you boil it down, it's basically application of engineering principles to biology, medicine, healthcare, and life sciences. And there are a number of, sub-branches of bioengineering slash biomedical engineering slash biotechnology. Some of the key ones are biomedical instrumentation, as you mentioned earlier, which is the application of engineering principles in developing medical devices. And then there's biomechanical engineering, where it's the application of engineering for anything related to mechanical aspects of medicine. It could be things like, hip joints or artificial bone and stuff like that, gait walking and stuff. Then there is biopharmacy, which is application of pharmacy to medicine, things like drug delivery modeling, drug delivery applications, Then there's life sciences, there's biotechnology, there's bioinformatics, and I'm probably missing out a few more key ones too.
Mhm. So could you explain us like actually can we go with what's your specialty at your work? What do you specialize in?
Currently, I am leading the OEM group at Massimo here in Irvine. When I say OEM, it means original equipment manufacturing. And we are a medical device company. When you go to a doctor's office, usually the first thing that they do is they put a pulse oximeter on your finger, which measures the amount of saturation you have and how well your lungs are functioning. It can give you heart rate, it can give you a respiration rate, it can give you a saturation. So we specialize in that. And I run the OEM division where we kind of market and sell our technology and do product development where we are actually using our technology embedded in other systems. Like, for example, GE, Philips, and other major medical monitoring companies, they OEM our technology. That is, they basically buy the boards that go into their monitors. So I've been in the OEM business for the last 15 years of my 25 years career, and it's kind of interesting in the sense that you get to work with your competition too, because sometimes the competition will not have a certain technology and they would like to OEM that technology from you. So it's been an interesting journey so far.
Wow, that sounds really fun. So if someone were to want to work in your company, what should they major in?
I
Or
mean,
like,
of course, having a biomedical engineering background is definitely, I mean, a positive. But not everything is kind of oriented or focused on biomedical. I mean, we have people in our company with a vast backgrounds. I mean, there are people who have done software engineering who are kind of help with the system architecture and the system, working of medical devices. And there's hardware engineering people who have gone through electrical engineering who design these devices, the hardware aspects of it. There's people who work on the display technology, so software to show the different parameters on the screen. People with mechanical background who develop the concept and the look and feel of these medical devices, and also the durability, how it's connected. Is it a bedside monitor? Is it a patient monitor which sits on the rails of a transport cart, or does it sit next to an ICU or an OR? So there's a wide variety of uh, people with different backgrounds. But the biomedical engineering is the kind of the key part of it because there's a lot of need to understand the application with medicine and how you're developing algorithms to treat people.
I see. Now, I want to ask a bit more about your career journey. So, could you walk us through like what you did after college to where you are now? What steps you had to take to come where you are now? Yeah.
Sure. So as you pointed out earlier, I started with instrumentation engineering for my undergraduate degree. Applied to that was back at the RV College of Engineering in Bangalore. Applied to several universities here in the US. Started off with a master's in biomedical engineering at in Ohio. And then I came over to, the journey has been interesting. So at Ohio University of Akron, I was working with neural networks and application of signal processing. And in one of the conferences, I met a professor who was also in the same field of neural networks. And he was really interested in my presentation of my work for the master's. So it was an easy transition to go over to the University of Utah in Salt Lake City, where it was a bioengineering lab in the Department of Anesthesiology. So that was where I really learned the key applications of engineering in medicine. We had the ability to walk into the operating room, look and participate in open heart surgeries. And this was a long time back. So these were times when we still had pagers, and when there was a cardiac case, they would page me and say, "Hey, then it's a cardiac case. Do you want to
Yeah.
come and collect some data?" And so you had to look at that number on the pager and call them back and say, "Yeah, I'm coming over to the hospital." And then, the lab was right in the hospital. So was able to develop a system which kind of non-invasively measures cardiac output using CO2 rebreathing. So basically, the circulatory system and the lungs are all kind of related. How much of carbon dioxide you expire is a function of your functioning of the heart. So worked with some really bright engineers and doctors out there, and that became a product. And so when I graduated with my degree, it was a very easy transition for me because the company which was sponsoring it was like, Dinesh, can you come and help us with the engineering aspects of it? So I moved from Utah to the East Coast, Connecticut, where the company was called Novometrics Medical Systems. And within 6 months to 8 months of me joining there, the key person in management and marketing had to leave for different reasons. So they said, Dinesh, you
Mhm.
know the product. Why don't you come and help us with that? So I call it the dark side, went from engineering to the marketing, the business aspect of it. And then Novometrics was a small company. So a bigger company called Respironics from Pittsburgh, which specialized in ventilators, acquired Novometrics. So bigger fish eating a smaller fish. And then Philips acquired Respironics. So I was in Connecticut for almost 19 to 20 years, but was had three different email addresses, different
Wow.
roles, and I really was not planning on moving from the east to the west. And here at Massimo in Irvine, there was a guy who was in charge of the OEM business, and he was retiring. And they said, "No, you can't retire till you find a replacement." And I had crossed paths with him at Novometrics almost 15 years or 20 years back. So he gave them my name, and then it turned out, I mean, I eventually landed here, and I've been here for 6 years, enjoying every day of what I do.
Wow. Thank you. Now, I have one last question. Were there any misconceptions you had about biomedical engineering before you officially started working in anything? Like, did you have any doubts about it?
Not exactly. I mean, for two reasons. I mean, at that time there was really not so much of differentiations between, I mean, the different areas of bioengineering, biomedical, bioinstrumentation, things like that. When I did my bachelor's was instrumentation, I knew I wanted to be involved in medical devices. So it was kind of, I mean, what I would tell you guys is do your homework to start with. I mean, try to figure out what areas you're interested and what you want to be. Talk to people. I mean, right now you're doing the right thing and listening to people. I mean, listening is the first thing that you need to start with. And talk to people, listen to how they got into what they do now, and see what jives with you, and try to figure out when you do that, you really won't have misconceptions of what people do. I mean, for example, on the bioinformatics side, when I joined biomedical, I mean, I had no idea of what bioinformatics was, and today I have a better understanding of, I mean, things like that. So, do your homework is my advice.
Thank you, Dinesh Uncle. I think on that note, we will move on to the next speaker, Umesh Satyanarayan. Once again, thank you, Dinesh Uncle.
Thank you.
Dinesh Uncle, I have a question for you.
Sure.
So, when did you have the feeling, or like, when did you feel inspired to start liking medical devices and to go work in that field? When did you feel like that was what you wanted to do?
I think at a very early time. I mean, as you probably have heard in most of what you call as uncles always say. I mean, there was always a choice between, okay, either you do medicine or engineering or you were a failure. So it was, I mean, it was, I mean, my family, my dad and my brother were engineers. So there was so much focus on engineering. I was interested in medicine to start with. So my interest in biology had peaked, and I did well in biology in my high school. So all along, it was, I mean, I was going to be in some kind of a medical field, either medicine or in biomedical engineering. So I think probably very early stage.
Got it. Thank you. So Umesh Uncle is back now. Can you start with a small introduction about yourself and then your company, what you do?
Yeah, sure. I'm Umesh, and I work for L&T Group of Companies. Currently, I'm with L&T Technology Services. I've been with them now for 24 years. I joined their L&T Medical 24 years back. I started my career with GE, so installed first CT scanner in Indore in central India, serviced a lot of ultrasound scanners in central India. And my passion started way back in 11th or 12th grade when I was studying biology. It's a some way, somewhat, you explain a concept, I used to capture it very well. And it came out so easily. Then I felt, I'm going to get into the instrumentation. I did from Mysore University instrumentation with major in biomedical. And I remember the professor over there, we had a very good conversation and he was recommending a lot of books. I used to just buy books and start studying. So it came out very easily for me. And GE, that was my very first job. And at those days, 25 years back or 30 years back, it was joining GE in India was a pretty good offer anybody could get.
Mhm.
Okay, so coming back, I did not. Someone felt that I have more than getting into the technicalities. I can face the customer. I can have a conversation. So today I'm in the sales. I had the new business development for L&T Group. I've been with them for 24 years. So currently focusing more on biopharma as well as life sciences. So it started with medtech. Just to give you an example, added to what Dinesh Uncle talked about. You take a signal from the body. It says something about your any organ or about your health, and you amplify that signal, you correlate with other data, it will tell you something about your body, any organ, how what is your well-being about. Now, that is all about what Dinesh Angal said from the patient monitoring. But what I'm doing right now, focusing more on the biopharma state, meaning looking into the cell biology, take the DNA sample, look for specific stream of data coming out of the body, and look for some specific diseases that may be caused because of some kind of a gene mutation that can happen in the body. So we at the company, what I'm working for L&T, we are more focused on applying AI on the bio data that coming out of these cell DNA.
Okay, wow, that's really interesting. So now, what skills and competencies would someone need to succeed in this field? You
Yeah.
could, yeah,
So just be very thorough on your fundamentals. Basics is important. So
okay,
cell biology or understanding microbiology is, it may be just a science degree to start with, but you will get to know the fundament of cells, how it performs, how the various organs perform and how they are interrelated. Why am I saying this is the data coming out of one specific parameter can talk a lot about, consider CGM, continuous glucose monitoring, why glucose spike happens, or why lot many insulin is not being generated. It all comes down to the cell biology. So understanding the performance of cells is very important. There are numerous degrees available today to understand more about microbiology or getting a basic biology degree to start with. Then in the masters, you can certainly focus more on, I want to become a biomedical instrumentation engineer, or I want to focus more on microbiology, or I want to do further uh, deep dive into biochemistry. All these three aspects are available today in the masters.
got it. And then after your college, what opportunities were out there for you
So
to continue in
yeah,
this field?
it way back 25 years back, there was nothing called bioengineering. It was all about biomedical. Even the degrees what I graduated, it was all biomedical engineering. That's what it was. Now it was all about sensors attached to the body, collect the data. Then you have instruments that will display something what Dinesh Uncle talked about. Now it
Yeah,
was or that is on the patient monitoring side, but you can scan the human body for any kind of CT scans or MRI scans. Even it was available, the technology 20 years back. So we never dwell deep into the cell level. Though the microbiology, all this started last 10, 15 years back, there was not a degree called microbiology or a cell biology and all. It was more about instrumentation. If a patient is admitted to the hospital, how do you get his vitals? How do you display, get some imaging? That's all it was all about 15, 20 years back. Now things have changed. Just to give you an example, today's if you call an ambulance, the ambulance has a data which is, let's say you are admitted anywhere earlier and there is some electronic medical data available today in the cloud in one of the hospitals, wherever your electronic medical data records available. Now, if I call 911 and the ambulance picks me up, the physician or the clinic emergency physician will come to know what was his vitals earlier, what is his parameters doing today, and within span of 10 minutes they can get to know what's happening in my body. They can get to know what kind of team of professionals needs to be required to address it. Now
Wow.
you see here, one is 20 years back, it is all about instrumentation. Today, about what do you do with the data? How do you improve the healthcare? And it's a combination of technology plus the professionals who understands the biology.
Yeah. Wow. And then I'll ask the same question. So, when did your interest spark in this field? Was it earlier in high school or later in college?
Uh, yeah, so it was on 11th or 12th grade, where there was a specific focus on biology. There were three chapters in that. One was zoology, I remember. Second one was botany, and there was one more thing. So whenever you talk about the organisms, the cellular level, or looking at the all the mammals, or looking at the core biology concepts, it came very instantly. I mean, I was usually able to grasp all those uh, the fundamentals, the cell behavior. One of the interesting concept I still remember is the animal behavior. Why do a specific animals behave that way? Uh, if you ask me, you need to understand what really ticks you, what makes you really interesting to understand a concept. It comes out see so easily. That means you need to start focusing on that. Can I build my skills on top of that? That's how it worked out to be for me. And I'm fortunate enough. I'm able to connect with some of the professionals. Again, see, I'm not going to right now. I'm not into engineering, core engineering, but I'm in the mostly on the marketing and the sales side. But my fundamentals helped a lot today for me to understand and talk the same language what the today medical professionals can understand. So the fundamentals
Wow.
has to be very clear. So it may be a little bit boring to do 3 or 4 years of just the biology, but I'll tell you, it's very interesting. That's where your fundamentals get stronger. Then you can focus on what will be your next step.
Yeah. Now, I would like to ask some questions about like your sales job. So now you're saying knowing your fundamentals will help a lot. But what kind of skills would you need at least with your job? So selling and all that. What helps a lot doing what you do?
Yeah, this requires the concept of sales 101 plus understanding of about your customer, whom you're talking to. It's not just selling here. You need to understand the problem statement. Consider companies like Philips, GE, or Medtronic, three big, top three big companies today in the market. What kind of, whether they are working on cardiovascular or working on just the patient monitoring or looking at next generation imaging technologies, what kind of problems are they trying to solve in the market? Once you understand, then figure out, okay, can I make a pitch so that I can solve that problem? What kind of skill set I have to solve that problem? Do I have a proof of concept? Do I have that capability? Have I worked on a solution to solve that business problem? So it's a combination of understanding who is your customer, understanding some elements of technicalities, working with your technical team to put together a proposal or making a pitch. So it requires complete full round. You just understand what am I trying to solve, understand your customer, and of course there is one element that comes in very very clearly. How can you so be very persuasive in following up? Second one, how can you build a very good relationship with a potential prospect?
Yeah. And then for my final question, I just wanted to ask if there were any obstacles you faced during your time. So after college, when you were looking for jobs, or even before that, any major obstacles that you had to overcome to get to where you were today, or where you are?
Yeah, so it's not always a straight path. Sometimes you get the challenges. You'll be asked to work on a particular project which you don't have any interest. I'll tell you, take up that project. The reason I'm telling you is it may not be related to your journey. However, you will get to meet people, you'll get to build relationship, you will get to be a very good team player. So it may be a temporary, it could be 6 months or it could be a 1 year. Sometimes you may have to, it may not be all straight line. What I'm saying is, so no, I want to be in this path. Yes, you can be in that path, but you don't have control. You may be forced to take up a specific project or a role in an organization, but stay through that. Be very persuasive and be very patient, but don't give up. And in parallel, I will tell you something. Start writing articles, be knowledgeable. Take now, there was no Coursera, or there was no other all this online educational things 15, 20 years back. Try to build your knowledge and know-how. You once you start showing as a, hey, you are a thought leader, you have written some papers, you're knowledgeable in industry, people will pick you up. So it requires a lot of hard work. It's not just a straightforward, but don't give up. Be very persuasive.
Yeah. So one more thing I want to ask. AI has been emerging in all types of fields. And I want to ask, how much of an impact does AI have? And then how much would it help in this field? So if you know how to navigate through AI, how much can it help in this field?
Yeah, it's a tremendous what we have seen, particularly in last 5 years, even during the COVID period, how imaging technologies combined with the AI powered engines are helping radiologists. For example, just to touch upon the X-ray, given a your X-ray image, I can tell you, check an X-ray of the lung. There are 20 today, around 28 biomarkers that can detect a specific infectious diseases just looking at the chest X-ray. And if you have a dual-sided CT or looking at the MRI, you can go to the much higher level. So you don't, people say we don't put you under the knife, meaning you don't undergo any surgery, but we can tell you, giving a strong image of a, wherever we have a diagnosis done, we can tell you what kind of diagnosis can be done without undergoing the invasive surgery to start with. So AI is playing a vital role. Uh, it's the fundamentals of imaging, image analysis, stitching together the images, applying specific algorithm. It's very strong. There are many courses available today in the market or the industry who are focused on imaging technologies. That's the one piece. The second piece, I started with the cell biology today. There is so much data available coming out of, I'm sure Abhi will talk more about on the gene sequencing. I'll not take the thunder on that. I will stop there. I want Abhi to talk more about the cell biology on the gene side. But imaging technologies powered by AI is making a lot of impact. I have one more point to share. This is more on the medical data. I'll come to it, in probably in few minutes from now.
Yeah. Umeshanko, just one more thing. So I know a lot of people who they either like software, like engineering, coding, and everything, or they don't. But is this still a field where they can still pursue it even if they don't like software and like programming and everything?
I'll tell you something. I have seen some doctors learning some Python programming just to apply AI things. So it's not a right. Keep your fundamentals. I'm not saying you become an expert in coding, but get to know the fundamentals of it. So in a hospital, there is a software called Epic, which is the electronic medical record. Those Epic software can be customized if that is being used in patient onboarding, if I'm using that in lab, or if I'm using it in cardiovascular or in the ultrasound. There are various domains within the hospitals. These physicians are able to make some changes in the configuration of that application. So uh, I would say it's a good try to characteristic to at least to understand the fundamentals of programming, and that helps a lot in the future. I have seen physicians taking up some courses to understand that.
Got it. Well, thank you, Umeshanko, but I believe now it's time to move on to our next speaker, Abhi. So, Abhi, could you just give us a quick intro of yourself, your job, and then how long ago you graduated college and like what you did in college? Just yeah.
Sure. Yeah, so I'm Abhi. and I'm currently a senior product development engineer at a cardiovascular company called Encora Heart. We're a startup, and we're basically developing a mechanical device that goes in your heart, left ventricle, that pumps blood to the rest of the body to help patients do that more efficiently, to help improve quality of life. And yeah, my background, my undergrad, I did it at UC Irvine. It was in biology, actually. And my master's was also at UC Irvine in biomedical engineering. So, I mean, just like Umesh Uncle and Dinesh Uncle, I have a similar background. I got interested in initially in the sciences and biology in high school, taking, I'm sure, like AP Bio and things like that. And also at the same time, I was interested in medical devices, things like that, because my older brother was studying medicine, so had that influence there. And getting to see how the medical devices are applied and how technology is applied to the field. And then in my undergrad, I started off with doing research, so on like genetics and stem cell research, which was pretty interesting. That was initially my experience getting hands-on in the field. And then I sort of transitioned to bioinformatics later in undergrad. Got interested, that was more programming, statistics, and there's a lot of for bioinformatics is basically there's a lot of DNA, RNA, protein data that you get from a lot of the sequencing that you do. So for DNA, you get a sequence of genes and things like that. And then how do you process that? How do you relate any mutations that you see to diseases that are related? So I was sort of doing more of that later on. And then I, wanted to get a better picture of medical devices specifically. So bioinformatics is it's a little different, but my master's was biomedical engineering, where I took a much more focus on core engineering. So like more of like electronics, mechanical engineering focus, and still, took courses in data science related things. And yeah, undergrad and graduated 2020, master's 2022. So, I've been working for about 3 years now.
Okay. Now, since AI is more upcoming, I'm guessing you've had your personal share with working with AI, right? So
Mhm.
could you talk a bit more about, I think Umesh Uncle is starting to talk about it, but could you continue on that?
Yeah, sure. Yeah, I mean, as they said, AI in the recent years has pretty much gone into almost every field that you can think of in some way. So, specifically for bioinformatics, this field, there's so much data. So, for example, for DNA sequencing, the previous company I was working at, we were developing a DNA sequencing instrument. So, these are used for processing, for example, like genomic samples for cancer treatments. So, for example, cancer is a huge application of this where you have patients and they want to see what type of genes or what type of mutations and tumor profiles they have so that they can use the proper drugs and cancer treatments on for that specific gene mutations that the patient has. So they do sequencing on their samples, get an idea of the genes and mutations and everything. So in this field, there's so much data that you get. The AI does, you know, help in terms of the analysis of that data and gives you an understanding of, okay, with these mutations, how does that connect to certain diseases that they could have and things like that. So also with like there's clinical like biomarkers where, again, there's things that relate to diseases. So I think AI is still coming into the field. Bioinformatics is definitely growing. So if you're into computer science and also, you know, something clinical, I think there's definitely growing opportunities here.
Got it. Now, could you describe us like what your typical workday would be? So like your day-to-day schedule, something like
Yeah.
that.
Yeah. So in my current role, it's more of like R&D, like more of like mechanical engineering because the device I'm working on. Um, and so it's pretty much half of my work is like documentation, designing different features of the device or how do we test it better? How do we set things up? So my work is still like pretty technical on that sense. Um, and then other half is actually like running tests and experiments on these devices that we're developing, and then getting an understanding of the manufacturing of those instruments, how we improve that in those processes. And because, in the medical device space, the FDA is like very heavily regulated. So a lot of the work is just technical documents, a lot of reading, a lot of
Mm,
writing, those things and understanding. Yeah.
got it. And then I want to ask you, what challenges did you face, like from your college time to now where you're working? And then
Yeah.
if you,
Yeah.
sorry, if you also had the chance to like restart, would you do anything different?
I would do a lot different probably.
Okay.
But no, I think yeah, last couple of years definitely since I graduated till now, things they changed pretty fast. With AI, obviously tech related. But I think one thing in general that's positive about healthcare and medical device space is that change, it is a little slower. Things don't implement too quickly because we're more careful, healthcare. So you have time to develop skills and they'll still be relevant even in like 10 years or 5 to 10 years. So that's one thing. But challenges, yeah, definitely for me, it was sort of picking and choosing what area I want to focus in. Initially, yeah, like bioinformatics, that side I was interested in. And then, more and more I worked with devices. I did like internships with sensors, and then like cardiovascular devices. They got me interested in that. And, that's where I wanted to move, and that's where I eventually am right now. So I think this is a field that I would stick in, but it was initially just, yeah, just deciding on what to do. There's so many options now, bioengineering, biomedical engineering, research versus more of an like engineering side of things, hardware. So there's definitely a lot of things out there. So honing down on one specific thing was challenging.
Got it. I think I'll probably have that same problem too.
Yeah.
Now, and then I want to ask you, what personality traits do you think would like be a good fit for this profession?
Yeah, there's a lot of different types of people. Just the general things is being detail oriented, especially if you want to work in like technical area. Um, yeah, just being able to focus on details, paying attention, and just being technically having a good foundation, like Umesh uncle said and Dinesh uncle said, it's getting the grasp on the key areas, whether that's core engineering principles or biology related things, um, getting those. And then also a huge thing is people skills, communication, working well, working with a team, because you're always going to be part of a team. So I know, or, team group projects and stuff are not fun when you're in school, and there's always, one or two people who are not doing their part, but that's just how it's going to be for, yeah, the rest of your work. Usually you have to work well with others, different types of people, they have different personalities and different strengths and weaknesses. So I think developing those skills is going to be relevant for anything you do.
Got it. Now, I would like to ask, what advice would you give to a student who would be considering to further pursue this career or this field?
Yeah, so biomedical engineering is in general, it's more of like a general field. I think whereas, some other majors, it's more specific. Like if you're doing electrical engineering, it's going to be heavy electrical, but biomedical engineering in college, they cover electrical engineering, they cover mechanical engineering, they cover programming and science. So they're just much more diverse. So I would say as early as you can, try to figure out which of those areas you tend to like and you're good at, and then trying to be more specific, take more courses in that area, or get some experience in that area. And what helps is also, yeah, like just having these type of sessions or getting to talk to people who are already doing something that you're considering. And I've reached out to Umesh Uncle. I've talked to Dinesh Uncle before to get advice and guidance. So I think most people you reach out to will be willing to talk to you and help you and give you some advice. So that's the one thing. Yeah, just reach out.
Got it. And then Dinesh uncle and Umesh uncle, would you guys like to add on to this about any advice you guys would like to give to us students who are still not sure of what we want to do?
Want to start, Ramesh?
Yeah, Dinesh, I'll go. So, uh, I'll tell you something. Look for you. What is your passion about? It's very difficult, but I know somewhere you can find out what you're good at it. You may be good in, solving some business problems. You may be good in coding. Pick up that initial trait and add on to it. Then you can bring in the element of biomedical or anything to do with the medical science. So the understanding your potential skills, the traits are very important. It even to understand that also if somebody else can act as a coach and a mentor to you, listen to them. So what you don't see, others can see in you, is all about the coaching and the mentorship. And I'll tell you, somebody had seen in me. I think you can go meet with the people, you can go face the customer, which I was denying myself. And I was interested. No, I want to be in solve a technical problem, take up the project, and sit inside at the four walls in my cubicle and do it. No, that's not happening. I'll tell you, somebody had seen me 25 years back. They pushed me. No, you go out to the field, meet the customer. So listening to others is always very important. There should not be a denial, because one person can go wrong, but two, three people trying to have seen you, trying to guide you. Please listen to them. That coach or a mentor is very important. But if somebody advises you, take a look at it.
Yeah. Thank you, Meshanko.
Great, great.
Dineshanko, do you have anything?
Yeah, just on the same lines as Umesh, I mean, as I said earlier, listen, I mean, talk to people, ask them, keep your mind open, keep your thoughts open, talk to them, get ideas of, I mean, what interests you and what you want to become and the paths that people have taken. And more importantly, strive to be the best in whatever you do. I mean, you may choose biomedical instrumentation today. You may end up in a completely different field. I mean, of all the 30 students in my undergraduate who took instrumentation, all my friends, I mean, I'm still in contact with all of them. They're all in different fields. I mean, not everyone is in biomedical, probably just one or two. The remaining are in different fields: software, engineering, business, pharmacy. I mean, some even have retired, saying, "Hey, I'm done. I'm this one." So, I mean, life takes us in different paths. Being an expert in what you do and being happy in what you do is more important than saying, "Oh, I'm going to be this." And if you don't become a biomedical engineer, if you don't, I mean, achieve what you do, I mean, what you wanted to do today, your paths can change. Be flexible, be moldable, and you're at a very young age. And at this age, it's just like the urge to learn and excel in what you like.
Yeah. And then I have another question for all three of you guys.
Mhm.
What have you, what kind of activities have you done to, in a way, prepare for this field that you're working in?
Maybe I'll start. As Umesh mentioned, I mean, and
Sorry,
as I mentioned,
let me rephrase it. So,
okay,
like, if a student wants to pursue this, what would be good activities for them to do?
yeah.
Like that they're
Yeah, I mean, I'll go back to what Umesh he mentioned about cell biology, right? I mean, if you're interested in the bioengineering aspect of it, as we mentioned earlier, all of this relates to, I mean, medicine, healthcare, and life sciences. So the bottom denominator of all of this is biology. So excel in biology, learns, I mean, if it's molecular biology, cell biology, or physiology, just how the body works, the interrelationship between your lungs. And I mean, if you think about it, for us to be talking here and we walking and listening, there's so many things going on. There's your brain, there's your heart, there is your lungs, and there is your, I mean, muscles. All of these things are working in unison in order for you to function. So what is it that makes you click? What is it makes you, I mean, what causes your heart to beat with each this one? So try to understand that, and that's the basics for this field.
Thank you. Umesh, Uncle, Abhi, do you guys have anything to add on?
Yeah, I'll tell you. So there was no cloud. There was just a web page being web JavaScripts being written. So web page were coming up. Today you have Coursera. Believe me, even though I'm having now 26 or 28 years of experience in the field, still there is a lot of room for me to learn. But one advice I would like to give is there is so much available today in the Coursera. I'm not just promoting Coursera, like Coursera. Go ahead and take up some courses. You will, even though you may like it or you may not like it, but you'll come to know what you don't like it.
Yeah,
So pick up some pretty good topics. You will come to know the moment you pick up some concepts easily. There is something in you that is provoking you to take it up, learn more. What is it you only have to figure out, but there are options available. And I would certainly recommend in your free times take up courses. uh, Abhi just mentioned, I don't know how many you have captured. There was an influence. His brother was doing medicine. Right now he is a doctor. He is already practicing. His brother's profession impressed on him. I'll tell you, in my case, my dad was a salesperson. Somebody was telling me, "Oh, so your dad was a salesperson. You became," but not necessarily in the medical field. So there is always an influence that will happen. You figure out, something. What is that ticks you matters a lot.
Mhm.
yeah. Thank you. Abhi?
Yeah, I think just adding on to what Umesh Uncle said, um, it's just as important to figure out what you don't like as it is to figure out what you do like. So that'll help you narrow down in general, what you could be interested in. So yeah, to start general, like, do you like research? If you have an experience to get into a research lab, just think about do you like that or not? And then you can narrow down, okay, if you don't like research, okay, then you can completely focus on something that's not related to research. So yeah, just be able to be flexible, yeah, explore. There's people to reach out to, there's courses, definitely. And also I just want to add on that it's almost never going to be a straight path. Your interests will change over time, and that's fine. But at that time, you need to be able to just transition to something else and just keep putting 100% into whatever you transition to. And everything will build on each other. So it's not like a previous experience has gone to waste. There's always something, either skills, either people you've met that will help you. So just keep a more flexible outlook. And yeah, careers always evolve and you'll always change. So,
Thank you. That was actually some really good advice. Does the audience have any questions? How you guys can post it in the chat.
Hi, Arya. I just had like a question for all three of our speakers. So my question is, I think what was the main thing that made you decide that that you wanted to like continue down like that career path? So what is it like maybe like the first course you took or maybe like your first project or like work with the professor or something like that? Was there one main thing that made you decide that this is what I want to do for the rest of my life? And can you like explain like also like why that made you feel that way? Like what it was about that thing that interested you so much?
I'll take a tab at it. So, so there was a physiology all about understanding the human body. Just that was 20, 35, 25, 30 years back. Then came in a lot of cell biology. The next phase, you will all hear more about the drug discovery. How does a specific a vaccine or a biological any drug has an impact on the body? If you see, all the three things are related. What kept me going today, I'm very passionate about medical licenses or biopharma, is it's ever growing. There is a marvel of research happening that keeps you wondering how complex the human body is. We are trying to one is we are finding a new technological way advancing to improve the healthcare. So uh, the technological advancements uh, added to my passion in the medical and life sciences kept me. Today, if you ask me to go back, I want to do one more degree. I would rather choose a something to do with the drug discovery phase. So that's how the passion has embedded in me, purely towards the love towards the human body.
Dinesh uncle,
Yes,
the
sure. So yeah, I think it's not just one particular incident or course or anything. It's just my fascination with how the heart functions and what makes it tick, what makes it beat, what makes it kind of go. And as I said, when I was at the University of Utah, I had the opportunity or the blessing to be among cardiologists when they perform operations on the heart, when they basically, freeze your heart and stop your heart, and you have a machine running your body at a certain time. It's just fascinating. It's just fascinating how a heart which was not working for the 2 hours that they were working on vessels on top of the heart and how they get it back starting. Life is fascinating. So that kept me going. That even keeps me going even today. So the physiology part is the most interesting part for me.
Yeah, so um, for me, yeah, it was multiple things, but for example, in high school, we watched videos about like robotic surgery and trends in that. So for example, that was like interesting to me. I liked science, I liked engineering, so that was a really fascinating thing to see technologies in that space. And now robotic surgery has grown even more, much more since then. So it was things like that, and in general, I liked problem solving, and um, I wanted to apply that to this space, medical devices. The field is growing, especially with even like wearables, right? Like your Apple Watch, it has health metrics. So even a lot of these tech companies are interested in healthcare space. So yeah, I mean, it's just growing a lot, I think.
got it. Thank you. And then I think there was one question from the audience. We kind of covered this, but just to make it more clear. So is there an opportunity for people who graduated in like computer science or in bioengineering field, but they can go and work more towards computer science? And then like what would that be? I think we've went over it just to clarify it just a bit more. Yeah.
I can take that. As I said, in our company, there is openings for all kind of people with different backgrounds and profession. Especially, that particular question talked about AI and stuff. There is applications of artificial intelligence and signal processing to the physiological signals that we collect, capnography, pulse oximetry, blood pressure. All of these are basic signals, and there is always applications and experts who have domain expertise in algorithms or artificial intelligence, the ability to take all this data, boil it down to parameters or indexes that you can use to alarm a nurse or a doctor when something goes, bad, is there. So, the answer is yes. The answer is, with various backgrounds, you can still get into the bioengineering or the biomedical field.
Got it. Now, if there was the other way where someone didn't have any experience with biology, let's say they came from a computer science field. Okay. Yeah. Thank
Yeah.
you. Is there any other questions from the audience that anyone wants to ask? Any other youth committee members, do you guys want to ask anything? In that case, I'll give a quick recap of what we went over in this meeting.
Hey, Ari, just before
Yeah.
this one, on behalf of the panelists here, thank you guys for, actually having us here. And this was a very, very energetic, and the kind of questions we got were really, I would say, pretty high level questions. These were not basically, you guys have already thought about it. You have had, very pointed, life determining kind of, where you want to go kind of questions. Thanks for having us on this board, and more importantly, continue this discussion. Have this. This is a great opportunity for you guys to listen to people, and so keep, as I mentioned earlier, keep listening and have more of these sessions in different fields. So that's from as part of the panelists, my feedback.
Thank you. And so now for my takeaways from this meeting, this is what I've written down. So take more courses, try to introduce yourself to more topics. There's many platforms like Udemy or Coursera, and then make sure to listen to people. And there's a lot of instructors. You can always go and ask people if you're curious, if you want to learn anything. There's much more. I'm sure many other people have taken notes. So I wanted to thank you guys on behalf of the youth committee, on behalf of everyone. Thank you for attending today, and it was a great session. Shishmanti, would you like to take over?
Thank you so much. Thank you, Arya. First, I really want to thank a big thank you to all our amazing guest speakers for sharing your wisdom, stories, and inspiring journey with us today. So you have truly lit a spark in our youth committee. Thank you so much for taking some time and coming over and sharing all your experiences. I think it was truly inspiring. So, and I want to thank from KCA board. We always want to encourage and guide our youth committee by supporting and providing them resources and mentoring them. So we not only believe in youth committee ideas, but also empower them to turn them into actions. So when I was trying to say this once in our youth committee meeting, when Arya came up with this concept, I said, yes, why not? Let's try it. And this is very good for elementary school kids and high school kids. And sometimes, as parents also, we would not know, okay, what kind of major our kids have to pick. And, we would not know, basic engineering, of course, yes, few engineering, but now we have so many majors and different fields, and kids are doing like even from various, like not only engineering or medical, they're just even going for film industry and all those different courses. So getting an insight from our experience from all the speakers, I think it is definitely going to make a difference for even for the parents and the kids, youth committee kids. So I think this is our first session, and I think we have really nailed it and bringing this concept work. Thank you so much, Arya, and thank you for the whole youth committee team who all came together and worked as technical. I have all my youth committee kids here, so they will introduce after I speak. So thank you, everyone. And thanks to our audience for being so enthusiastic and encouraging and, participating. Thank you very much. And this is so meaningful. We had a best session today. Thank you so much, Arya, again. And I would like all our youth committee to introduce themselves. Thank you very much.
Thank you, Shishmanti. Now, will the youth committee start introducing themselves? I'll start first. So if you don't already know, my name is Arya Garish, and I'm currently the president for our KCA Youth Committee group. You guys can start just unmuting and go ahead.
Hello everyone. My name is Dhanav Gopal Krishna. I am the joint secretary for the KCA Youth Committee this year.
Hi everyone, I'm Anushka Rajiv, and I'm one of the KCA Youth Committee vice presidents.
Hi, my name is Samana Nadig, and I'm the Regional Fundraising and Cultural Coordinator of Orange County.
Hi, I'm Raksha. I'm the Regional Director for Youth Committee this year.
Hi, I'm Arnav, and I'm the Sports Director for the KCA Youth Committee.
Hi, I'm Nistro Bandaklar, and I run the Instagram account for KCA.
Now, on that note, I would like to once again thank all our panel members and thank all the audience for watching. We will be planning to have another meeting next month on a different topic. Once again, thank you guys.